Ancient Chinese, they discovered it is possible to cause some changes in the human body by skillfully influencing this energy which flow on the superficial part of the body. Right? So it can be done by inserting an acupuncture needle onto acupuncture point, which has the ability to alter various biochemical and physiological parameters in order to treat wide varieties of disease. That is the prime objective of acupuncture. But the conceptualization of the human body by the traditional Chinese physician varies greatly from that of the concept of the anatomy, physiology and the pathology of the Western medicine. And the concept of the internal organ and the viscera in TCM is radically different from that of the concept of the viscera in the Western medicine. So when you take the internal organ lung in the Western medicine, and all these components has to be taken into consideration when the disease manifests, and the symptoms of the disease might manifest in these aspects as well. Like we are treating for the asthma patient, there might be outward manifestation as a skin lesion. And when we are treating for a dermatological condition, there might be an inward manifestation as bronchial asthma. And this puzzle, why these acupuncture points do exist on our body surface? Right? So they were puzzling whether these points exist in our body surface for us to insert needles. No. They were not certainly evolved for us to insert needles, but the modern scientific research has proven that the point which are located in the surface of the human body, they perform kind of windows and antennas for us to exchange cosmic energy with the universe. Right? So why do we need to exchange cosmic energy? As I told you previously, this the body has to maintain and remain the energy balance with the universe. When there is an energy deficiency, then the energy has to be taken from the macrocosm. The body being the microcosm, the universe being the macrocosm, there will be a constant exchanging of energy, and that has to be restored. When there is a disease, when there is an imbalance, for your duty is to balance. So acupuncture points are areas of designated electrical sensitivity. So by stimulating these acupuncture points, by giving an acupuncture needle, stimulate various receptors. In turn, the nerves which are sending impulses to the higher centers of the brain. So that is what they were trying to prove by that new piece of research. And they were trying to prove different intensities of the classical technique of Chinese medicines, how we can produce the different intensities of pain by implementing different traditional techniques onto different acupuncture points. So that technique has been described as the Zheji or the acupuncture sensation. And they have found that once the acupuncture point is stimulated by implementing these classical techniques, it will send signals to the higher centers of the brain where the pain is being modulated, where the acupuncture sensation. Okay, TCM explained the traditional Chinese medicine believe the human body is a collective of interrelated yin and yang system. Right? So there are, as far as these yang and yin systems are functioning in equilibrium level, we are healthy. Right? There are many factors that this yin and yang system may be disturbed, like environmental factors, exogenous pathogenic factors, endogenous pathogenic factors, emotional factors, and all these factors avoid the radial artery and insert the needle perpendicularly to the Taiwan lung 9 point.